For those of you who don't know me, my name is Christina Hildebrand. I am the founder and president of A Voice for Choice Advocacy. We educate and advocate for informed choice of what goes into your body, be it food, air, water, pharmaceuticals. We basically want you to know what's in it, and you get to make the choice of whether you put that in your body or not. So first question, can California mandate the COVID vaccine for kids? I heard there was a clause in the law from 2015 that new vaccines that we can have religious exemptions. So the way the law is written says that there's a list of diseases that you have to be vaccinated for. And if the department, which means CDPH, if CDPH adds another disease to it, such as COVID, then they have to allow a personal belief exemption. A religious exemption falls under a personal belief exemption, but they have to allow a personal belief exemption. So the ways that a school can mandate, a public or private school in California can mandate the COVID vaccine is not by themselves. So that is not allowed. Interestingly, there are schools, mostly private schools, that are requiring it. We've sent them letters. Most of them have backed down. There's only one that has not backed down. Most of them have backed down by allowing just a blanket exemption that parents can sign. Of course, they don't let the parents know that. There's one that has a boarding school component, and they have been adamant that their boarding school kids have to be vaccinated, and the sort of accommodation that they're allowing is that you can become a day student. So schools cannot mandate the COVID vaccine by themselves. CDPH can put an order out that students need to be vaccinated, but if they do that, there has to be a personal belief exemption. The other option, which I think is very likely, is next year someone will bring forward legislation that requires the COVID vaccine, and I'm going to guess for 7th graders, because that's what it will be approved, or at least authorized for. By that time, my guess is it will be approved for 12 and up. And with that, as we saw with SB 277 and 276, it really depends on the legislature as to what how they will change the law. And so they could make it that only a medical exemption is allowed. They could make it that medical exemptions are not grandfathered, that you need a whole new medical exemption. They could make it that they are grandfathered. They could allow a religious exemption. I think it's going to be interesting to see whether they require the vaccination of teachers. If they require the vaccination of teachers, then they have to allow a religious exemption for teachers, which makes it more likely that they would allow a religious exemption for children. So that, I think, answers that question. The next question is, hi, my company is asking us to attest our vaccination status. I've been ignoring the email, 5th one, because I don't believe I have to answer by law. They finally gave an option of do not wish to disclose. Should I answer? I am applying for a religious exemption, but I have not submitted it yet. I'm worried I will be put on a non-vaccinated list and sent to the gulag. I don't think you'll be sent to the gulag, but do I think you will? So let me go through this. So attesting to your vaccination status, you just have to say, yes, I'm vaccinated, no, I'm vaccinated, or most have a decline to state. I would not lie on these, because at some point they will ask you for your vaccination card. And if you've lied on it, then you're out of luck. So I wouldn't lie on them. Whether you put that you're not vaccinated or you decline to state is really up to you. You get put in the bucket of unvaccinated regardless. So it's up to you whether you want to share your medical information. Now, what we've seen is most places that have the sort of attestation of vaccinate, you tell us your vaccination status, the next step after that is requiring the vaccine. And so, at that point, you do have to submit a religious exemption or a medical exemption. The one thing I will say about ignoring the email. So if it is company policy, and this applies to the vaccination as well, if you don't submit, if the vaccination is required and you don't submit a religious or a medical exemption, if you just ignore it, California specifically, and I think it's 39 other states, are at-will employers. So you can be fired tomorrow for no reason at all. You can also walk out tomorrow for no reason at all. But what that means is, if you do not follow company policy, if you are fired for not following company policy, i.e. not completing the attestation or not showing proof of vaccination or a religious exemption or a medical exemption, whatever the policy is, if you do not follow the policy and you are fired because of that, you don't get unemployment. So if if your paycheck's important and your unemployment, if you get fired, is important, then you want to follow the policy. You at least want to say, I don't wish to disclose on this, because otherwise, if you're out of the company will say they didn't comply with company policy, and so then you weren't let go for a reason that you can get unemployment. Okay, next question. How do you fight the denial of a religious exemption? In which court? So if you've had your religious exemption denied, I would say contact me, send me an email, Christina@avoiceforchoice.org. If you reply to the registration of this, you get to me too. The only reason they can deny a religious exemption is because they don't think your beliefs are sincere and you haven't shown that your beliefs are sincere. They can't deny you based on your religious beliefs. So I would recommend going to one of our workshops on religious belief exemption writing. But if you have used, for example, the ones that I've seen that are denied are not ones that have come through me first. They're ones that are being denied. And when I look at them, it's because they include science. It's because they include information on things like VAERS. They include legal stuff. They include a whole bunch of stuff that is doesn't have to do with religious beliefs. I'm not going to spend a huge amount of time on that because I am doing religious belief exemption workshops, and come to one of those and you'll learn all about it. Okay, next question. I'm a public school teacher and they are requiring all non-vaccinated teachers to be tested weekly. I was hoping that they would have a saliva PCR test available for me, but they only offer the nasal swab test for free. They said I could do the test on my own, but they would not pay for it. Do you have any recourse for them reimbursing me? Also, I'm sure that after the mRNA is approved, they will mandate it in our school district. Can you use a religious exemption if you're a public school teacher? So I'm going to take those two questions separately. The testing. So I get asked this question a lot. I agree. For anyone who, I'll take a step back. I personally recommend having spit testing. You want things to come out of you. You don't want things shoved into you. Is there stuff on the swabs? There are chemicals on the swabs, 100%. Is there more than that on the swabs? I have no idea. Does the technology exist? Absolutely 100%. So who knows what's on them? I personally would prefer to just spit and have it come out of me. Now, the saliva test, there's a company called Saliva Direct, and they use the Yale saliva test that's been EUA approved, and they have labs all over the country. And there are companies that that basically use their test. If you get it, you can look them up online. You can find them for probably at $50 online for a home test kit, which is expensive if you're testing weekly. If you have a bulk order of about 10, it goes down to $25 a test. And if you can find more people, so if you get up to 40 or 50, it reduces, and you're doing it on a weekly basis, there's a significant cost reduction. So what I've had people do or look into, I have one group of college students that are doing this, but other than that, I've had other people ask about it, is get a group of people together to do the testing together. And so if you get 30, 40, 50 people signed up, the cost reduces dramatically and you can do the saliva test. We are also, and I was going to put it out today, but I'll put it out tomorrow. We're going to put together a letter and send out a letter of basically that you can take to your employer and say, if you're going to have me do the testing, this is what I would like. And it requests the saliva test, and it requests other things. Now, most places will say, well, you can do that yourself, but you're on your own. Some insurance reimburses COVID testing. So I would definitely go to your insurance and see whether they will cover any of it. But I think if you can't get it, if you can't get it covered, if you can't get an alternative test in your place of employment, then I would, and I would see how many other people you can get together. If 50 people came or 40 people came to the school and said, we want the saliva test, here's the option, they may very well be open to that. But otherwise, I would do it yourself if you can. So the second question is that once the mRNA is approved, will they mandate it? They'll mandate it for the school district. Can you use a religious exemption? The answer is yes. So for any employment, There is lots of case law that a employer has to provide a medical and a religious exemption for anyone that is employed. Okay, next question. What can you advise in California when you can't get an exemption from any doctor because you don't have cancer and you're not a transplant patient, but have many health issues, including MPFHR gene, ADHD for kids and adults? So in California, it is close to impossible to get a medical exemption. The K through 12 issues with medical exemption, the removal of the personal belief exemption meant that children were forced to get a medical exemption instead. And in doing so, basically all of these doctors are being witch hunted. And so no one wants to give medical exemptions. If you're talking specifically about the COVID vaccine, I would go to your personal doctor if you have health issues and see if they will do it. Very often they won't, because there aren't real contraindications. The CDC has a list of contraindications for the COVID vaccine, but they are different for each vaccine. So for example, if you have Guillain-Barré syndrome, you shouldn't get the J&J vaccine, but you'd be fine to get the Pfizer or the Moderna vaccine, according to them. So it's, and like I've also seen medical exemptions from some schools that say the only way you can have a medical exemption if you show that you're allergic to an ingredient for each of those vaccines. So they all have different ingredients, but it's really hard to get an allergy test to any of the ingredients, even the PEG. The polyethylene glycol that's in the mRNA vaccines. I've tried to find a lab that will do an allergy test for polyethylene glycol, and there aren't any. So it's really hard to get that. I would recommend a religious exemption if you have religious beliefs. Or the other option is to just get out of the system and find a different way of doing things, or get out of the state. I know that's not easy to do, but I tell everyone you need to have a plan B. You need to work out what you're going to do if you can't, if you're forced to get the vaccine and you don't have another option. Wondering who you recommend to vote for the California recall. So a Voice for Choice advocacy cannot recommend an individual election person. So I'm going to take that hat off and I'm going to put my California Families for Health Rights hat on. So I'm not speaking as a Voice for Choice advocacy right now. So number one, the most important thing on the recall ballot is to vote yes. Okay, to vote yes and to get Gavin Newsom out. Now, I've had people say, really, but the key piece here, even if you're a staunch Democrat, is that our legislature is a super Democrat in a majority. They don't need any Republicans to do anything. And we need, in one place in the three, either in the Assembly, the Senate, or the governor, we need some checks and balances. We need somebody to play devil's advocate on the other side and put a halt on things. So even if you're a staunch Democrat, my response is, I would not, any state, even if it's a red state, even if it's a Republican state, if it has all three being Republican or it has all three being Democrat, you're in a runaway state because they can basically do whatever they want. You need to have some checks and balances. So number one, most important, if you do nothing else on that ballot, number one is to get a ballot. So to be registered to vote. If you can't, then if you go to CA for California, CA Families for Health Rights, we have all the information on there. But number one is to get a ballot and be registered to vote. Number two is to vote yes on it. Number three is the whole list of candidates. If I, with my California Families for Health Rights hat on, if I had to vote for somebody, I would vote for Kevin Kiley. He is a legislator right now. He's the one that took Newsom to court, and he really knows what he's talking about. And from a health rights perspective, so from a vaccine choice perspective, he gets it. The other person that I would say is Larry Elder. I think he has a better chance of winning at this point because he has more notoriety. But at this point, honestly, anyone is better than Newsom because we have to have those checks and balances. Next question. Do you think we should all file religious and medical exemptions to prepare for future issues? So I don't think you'll be able to file a medical exemption because I think it's far and few between that you would get a medical exemption. My recommendation is to have a religious exemption if you have sincere religious beliefs, is to have a religious exemption written. So the workshop that I do, we come, you come out of it with a messy version of a long form letter of a religious exemption. The reason why I say that is because then you have it and you've already collected your thoughts around it, and you have it in your back pocket. So do I think you should have a religious exemption on hand if you have sincere religious beliefs? I do, but I wouldn't necessarily file it unless you're being asked to file it. There are certain occasions where I would say that if you think you're going to get fired for non-compliance of something, having a religious exemption, if they fire you for not getting the vaccine for some reason or not complying, it's harder. It becomes religious discrimination, but only if they fire you for that reason. So again, in California, we're an at-will state. You can be fired for any reason. I've had at least 4 people, out of thousands, so not a large percentage, but I've had at least 4 people that have been fired 2 weeks after handing in their religious exemption for not vaccine related issues. So either they were downsized, the job no longer existed, they were no longer doing their job well after 20 years. Those people knew 100% it was because they weren't vaccinated, but the employer never said that that was the reason. And so there's no religious discrimination suit there. Okay, next question. What are your thoughts about the Novavax vaccine as a worst case scenario vaccine? So, pre-Novavax, and it hasn't been approved yet, but pre-Novavax, my answer is if I absolutely had to get it, I would get the J&J vaccine because it's only one vaccine. I would not get it. That's my answer. I'm not getting a vaccine. The same applies to the Novavax vaccine. The Novavax vaccine, I think, has a little bit better track record because not that we've seen any track record on it because the clinical trials haven't been reported on, but it at least is based on existing vaccine technology. Now, I have issues with existing vaccine technology, but it has a little bit more of a track record than other vaccines. The key here is we are seeing booster shots. Booster shots are coming. My guess is November, maybe October, but I think they'll leave it till November. I mean, we've already seen it, a 3rd shot approved for the immunocompromised. If you get one vaccine, you've just signed up for all the booster shots and all. I would really stand your ground. There's nothing that I'm going to say there's nothing that you can't do without a vaccine. You may have to get tested. But there's nothing you can't do without a vaccine at this point. I do think there's going to be, and I say that and you say, well, I need it for my job. There are exemptions or find another job. And, I'll say this, I know it's not easy. And it's, you're sitting there thinking, well, that's easy for you to say, Christina, find another job. Everyone on this call should have a plan B, whether that's moving out of state, whether that's finding another job that is similar minded, whether that's creating your own business, whether that's something else, but you need to have a plan B. This is going to get worse before it gets better. I think the only stopping in California we have is the governor recall. But even with that, I think we're, from a federal level, from other levels, there's just going to be pressure for a full-on, social credit system, et cetera, et cetera. You need to find your people and find a way to live off the grid, off the system. Doesn't mean to say you need to do that today, but you need to have a plan B in place that, in a week, in a month, in a year, sometime, if you need to exit what you're doing right now from an employment perspective, that you've got money that you're making from some other reason. Okay. Can you speak about the shedding from and graphene oxide in the jabs? Okay, so the graphene oxide has been found in the vaccines by a lab. I don't believe it's more than one lab that has verified it. So is it in there? I believe it's in there. I still don't have enough proof to actually say it's in there. One lab found it. I think there is looking at it, is it likely? Yes, it's likely. I'd like to see more evidence of it. I'm not the type, if you know me, I need lots of information to make a decision on something or to speak about it. And I look at every side of things. And so, the graphene oxide, I definitely, do I think it could possibly be in there? Yeah, I think it's likely that it's in there. But I think we need more information. As for shedding, and I don't know whether you mean shedding from graphene oxide or just your regular shedding, can this vaccine shed? So the answer, the scientific answer from the pharmaceutical industry is no. Do I think it has some effect? I do. How much effect? I can't tell you. I think it is also different people have different reactions around other people about this. I also think it's a lot psychological, and I don't mean that in a, oh, you're crazy if you think, this is getting to you. But I'm a big believer that a lot of what your health is about is your psychological mindset. So if you are afraid of shedding and you are around people that have been vaccinated and you are fearful of that, I think you are much more likely to have an adverse reaction to that shedding. I think if you take the stance of, I'm going to boost my immune system, I'm going to do everything healthy, I don't have a choice about being around, vaccinated people. I'm going to do everything in my power to support myself, to support my health, my physical health, my immune system, my mental health, everything else. I think you have a different outcome. But I think that's true of any disease or anything. I mean, you take things like cancer, you take things, I believe in, the wholeness of you and the energy of the world. And, whether you call that religious beliefs or something, some higher power, that the energy around us. But that's my opinion. You don't have to agree with my opinion, but that's my perspective. And you're asking me questions. So, okay, next question. I have filed a religious exemption with my employer of 25, assume you mean 25 years. They replied with a form stating that I would need to have a letter from a clergy stating that I'm in good standing with their religious church organization and that a person explains why I cannot be vaccinated. I replied with a copy from Title VII that showed this is not the case. Am I correct? I do not belong to an organized religion. You are correct. As I said, if you want religious exemption help, I would recommend going to one of my workshops, given that you've already submitted it. You are correct. So our First Amendment rights state that there isn't an organized religion that you have to be a part of in order to have religious beliefs. So that would be my answer to people who are not part of an organized religion. I would 100%, the worst thing you can do is download or pay for a letter from a clergy person and download it off the internet, or go to, like, there was a church in the Bay Area a few weekends ago that basically was, at the end of service, was just signing these letters. The point of a religious exemption is not for them to judge your religious beliefs or what they are, but to determine whether your religious beliefs are sincere. If you use something that is a boilerplate letter or downloaded off the internet, it is not sincere. And so you will not, it doesn't help you. But you are right in what you said. And if people get to that point, if you need I have a sentence that you can send them, and I'm happy to share that. Okay, next question. Do we really need to start making a true opt-out of society plans, homesteading, etc.? Is now the time to get out, or is there still time? You should have done it, I don't know, 2 years ago, is my opinion. 3 years ago, 4 years ago. Do I really think we need to opt out of society? I do. I mean, but I also sit here in my house with my kids in school, and I buy from Amazon, and I live in this world, and I go to Sacramento, and my answer is you need to do as much as you can, but you need to have a plan. My goal this year, or the last 2 years, was to raise produce on my balcony. I have very little space, but on my balcony. And so this year we grew, I grew quite a few of our vegetables. We had salads, we had broccoli, we had Brussels sprouts, we had tomatoes, we had, all sorts of things growing in a very, very small space. And I, vowed to buy as little off Amazon as possible. So I bought from all over the place. It's not as convenient. It's a little more expensive, but it's it is I need to get out. I need to work out what my plan is, and I can do little things. So I would say, very few people can just up and move. There have been people that I know, that have up and moved to another state, bought a ranch, and are, basically off the grid or mostly off the grid. People are homeschooling more. You have to do what you can do. But do you need to have a plan? I do think you do. I look at where we are, and I can go from, this is all just, somebody trying to be in control and power grabs, and, we've just swung too far this way. We're going to swing too far this way. And at some point, we're going to come back to sort of a more centered place. I can go from that to, we are in the midst of 1984 and a brave new world. And yeah, we need to get out. We need to work something out. Social credit score system is coming. We're all the way over there. Do I know where we are in either of them? Are both of them possible? 100%. But to me, do I need to try and work out as much as possible how I can live outside the system, the traditional system? Yes, 100%. And as I said, I think you have to have done it, years ago. But if you're starting now, now's the time. Because you don't want to get to the point where it's all there, it's all happened, and you're sitting there going, crap, what do I do now? But I would start with community. I would start with the people around you. Can you find, we started, Voice for Choice Advocacy started Stand Up California. You go to standupcalifornia.com. You can join your local county group to get people together, both from a standing up, going to Board of Supervisor meetings, that kind of thing, but also as a community, to find the people who don't need you to be vaccinated to, get a massage or to do those things, to have homeschooling groups, to get together with like-minded people, to come up with ideas of, what can you do now? So yeah, I definitely think you should. Okay. Are employers legally required to accept and approve a religious exemption? They are, as long as they believe you have that the beliefs you have in your religious exemption are sincere. So if you spew a whole load of stuff about science and emergency youth authorization, and it's not, it's not safety and efficacy tested, and clinical trials haven't happened, all of that is science. If you include that, it's not going to be accepted. If you truly write down your sincere religious beliefs and why you can't get vaccinated, yes, they have to approve it. Okay, next question. We have to test for attending school. Could you please share places that do the PCR test, preferably saliva test or at-home nasal swab with a CT value of 35 or less? So one of our interns, actually two of our interns that were working with us, have gone through every EUA PCR test, and there are very few that are under 35. Here, I can give you the numbers. So 21% of all PCR tests are below 35. Another 31% are between 35 and 40, and 48% are above 40. So the vast majority are above 40. Most of the saliva clear ones, the saliva direct, the saliva direct ones, which one of the companies that has them is Saliva Clear, they are run up to 38. So that's still lower than most. But the interesting thing is, if you create your own sort of group of saliva testing group, most of those labs, if you call them up and you say, I want a cycle threshold of 35 or 32, they will run it and report on 32. And so you can actually do it that way. Similarly, if you are a business and you are, your employees are required to test, if you are providing that test, you can ask for the test to have a lower cycle threshold. You have to have about 50 people. You have to have a decent number of people, because otherwise they add your saliva to other people's in the sort of as they run it. But if you can get enough people, then you can. How do we find out the CT value used for the PCR test that we are doing? I tried calling LabCorp Pixel, and the customer rep directed me to a 30-page document to figure out the CT value, though the document does not seem to provide the CT value for testing. So if you go to the EUA summary, if you go to the FDA website and you look at the EUA summary, it will have on it what the cycle threshold is that the test runs up to, but most of them are like less than 40. right? So it doesn't actually tell you what they run it up to. Most of them run it up to that threshold, but it doesn't necessarily tell you the exact threshold it's at. Okay, next question. A junior community college sent a mandatory vaccine notice 3 days ago to my son's on-campus attendants. We're wondering what to do next. So I would find out if they should have a religious exemption or a medical exemption. If your child has sincere religious beliefs, I would recommend doing that. If they don't, I would ask them what accommodations they have for people that are unvaccinated. So, is there any other options? Can you do it online? Those types of things. Okay, next question. What are the options if we have our job saying that we need to have the negative COVID test weekly or a COVID vaccine or lose our job? You have to test. Again, I would find a saliva test. I would find one with a low cycle threshold, but you basically have to comply. But having said that, so I've had various pieces on the spectrum. So I've had companies say you must do a COVID test, and people just haven't shown up for the COVID test, or they showed up for one of them and then never came back again. And those people, nothing happened to them. The other extreme I've had is where they have put in place a policy that says if you miss one COVID test, you're given a warning. You miss 2 COVID tests, you're put on probation. You miss 3 COVID tests, and you're fired. So, there's a big spectrum of what's in there. I've also had someone that went back to their employer and said, I really don't want to be tested every week. Please, can I not be tested every week? And the employer said, okay, fine, no worries. So it really depends on your company and what they're willing to do. Can your state override your constitutional rights? It's a good question. So legally, no. Do they? Yes. And that's where we have to stand up for our constitutional rights. Unfortunately, when it comes to public health, police powers usually override constitutional rights. So public health is considered something, and this comes from the 1905 Jacobson versus Massachusetts, that basically public health trumps everything else. So, your constitutional rights are diminished a lot during a pandemic or during an epidemic, even, especially here in California. Is it legal for medical exemption to ask for a specific diagnosis that doesn't allow someone to get the vaccine? Yes, if that's the policy of your employer and your employer is a private employer, yes. For example, and the K through 12 vaccine requirements, if you have a medical exemption, you have to give the medical reason for that. So yes, it is legal. It doesn't fall under, the next question somewhere is going to be, isn't that a HIPAA violation? I'll answer that right now. HIPAA is between you and your doctor. It's a privacy act that just says that your doctor cannot share your medical information with anyone else unless they have your specific direction that they can do that. If you are handing over a exemption that was written by a doctor to someone else, you have just, you've allowed them to see your medical record. So that's, there are medical privacy laws for employers and schools that they have to adhere to, but those are different laws. Okay. Is it true that all 3 COVID vaccines involved testing that used fetal cell lines traced to abortions in the 1970s and 80s? So yes, the J&J vaccine is the only vaccine that uses aborted fetal cell lines in the actual creation. So they use a DNA sequence from the aborted fetal cell line. The Moderna and the Pfizer vaccines don't have aborted fetal cell lines in them, in the creation of them, but they are tested using them. I have a daughter forced to 7th grade independent study because I won't do the DTaP because she had a seizure June 1st. I need a doctor for an exemption, or is that against the law to force that? You won't find a doctor in California that will write a medical exemption unless your child is going through chemo at an age where they should get the MMR vaccine or a live vaccine. They may push that live vaccine off for a few years, but you won't find a doctor that will write a medical exemption unless you have had a contraindication. And even then, it's really hard to find. But if you had a contraindication to a vaccine, it has to be that specific vaccine. And you have to basically have nearly died from that specific vaccine. So it is really hard to find it. My response is you have to homeschool, you have to move out of state, Those are your options if you don't want to vaccinate here in California. Okay, please clarify how exemptions versus common law approach will keep unemployment benefits intact. So there's a lot of talk about this common law approach. And while I've gone to meetings, I've gone to webinars on it, and I understand the concept of it. The problem is by putting in, for those of you who don't know, it's basically putting a notice of liability. It's usually 3 stages that you are putting your employer or whoever it is requiring the vaccine or whatever they're requiring on notice that this goes against your common law, which is sort of the most basic law of the land, that it goes against common law. The issue with this is, so you send the notice of liability to your employer, and your employer goes, okay, that's nice. You still haven't complied with our policy. You then file the next step, which they also go, okay, I understand. Again, you're putting me on notice, and you're really putting me on notice, and you're threatening a lawsuit now. And they go, okay, come at me. I think we can win this in court. And you have to realize the court system isn't designed around common law. The court system is designed around case law and statutes. So it's not even, we're talking apples to apples once you get to the courtroom. But then you file a third one, which basically is a threat of a lawsuit, and you're threatening them with a lawsuit. At that point in common law, you still haven't complied with the policy. So they can fire you at any point for not complying with the policy. That common law approach takes a long time. So people who have, vaccination requirements by September 30th, by August 15th, by, all of those, you don't have time to do the common law approach. You will be fired. If you are fired for not complying with the policy, you won't get unemployment benefits. So while I'm not adverse to the common law approach, if you're willing to lose your job and willing to not have unemployment benefits, go for it. But the last step of the common law approach is a lawsuit. That's what you're threatening. That's what you're getting to. Now, people will say, oh, but they backed down before that. Okay, great. If they back down before that, then okay. But you're not guaranteed that they're going to back down before that. And most of the time where, I've asked people, show me where this has worked. And most of the time where it's worked, there have been other things in play that I personally think are much stronger arguments or much stronger reasons. An example of this is in San Francisco. So in San Francisco, a lot of the San Francisco employees that are under vaccine mandates put forward these common law letters, right? They have the city has sort of pulled back and said, okay, you won't be terminated if you don't get vaccinated. If you know the background of what's happening in San Francisco, so much of it is union-based. The unions have told their employees, do not submit the paperwork, do not do this, do not do that. I can guarantee you that the unions played a much larger role than the common law letters in this. And I don't want to talk against the common law letters, but to me, it really doesn't make sense as an approach. Is it, I'm definitely somebody who throws spaghetti at the wall and sees what sticks. I'm not saying you don't do it, but you have to realize what realm you're playing in and the end effect of it. And so, and whether you're willing to go for that lawsuit, do you have the time and money? It's not inexpensive. Do you have the time and money to take your employer to court? They have, unless it's a small business, but for most of these, it's, large businesses, it's the state. They have the money to have good lawyers. And I don't think in a court of law in California, you're really going to win the common law argument. But that's my perspective. Again, it's all my perspective here, but these are my observations. And I will say, I should have started this off with, I'm not a lawyer, I'm not a medical doctor, I'm not giving any of this. All this is thousands and thousands of hours of reading and reading all sides of things. Like, I really want things to work. If we can find a loophole, let's find a loophole and let's go at it. But it's really from looking at, I don't just read our side of things. I read everything. I mean, Twitter is completely confused at who I am because I am watching as many pro-vax. I follow as many pro-vax people as I do anti-vax people. So it's definitely comes from that piece. Okay, next question. Any law firm you can recommend for consultation about the rejection of a religious or medical exemption for a COVID vaccine, about what other legal options available in my state, if any? I don't know what state you're in, but my recommendation, if you have had a rejection of a religious exemption, a rejection of medical exemption is much harder. And, so I'm not going to talk medical exemption. I don't think there are many lawyers that would take that up. But if you have had, unless you have, unless you can prove, unless you have a really, really solid medical exemption. And if you have a really solid medical exemption, I would be surprised that you would get it rejected. But I would recommend send me the rejected religious exemption, because the first step you need to do is to appeal it. And if your employer doesn't know what they're looking for, i.e. doesn't realize that they're looking whether your beliefs are sincere and not judging your beliefs, then they need to be educated on that. Okay, can we do a religious exemption for masks and testing? My short answer is no. The reason for that is I haven't seen one. I've seen them being tried. I haven't seen one being approved. There's really no religious reason not to mask and test. And what you have to understand, if you have a religious exemption for vaccination, what you are agreeing to is a reasonable accommodation. So you're agreeing to, quid pro quo. You don't get vaccinated, but you still have to follow public health measures in the workplace. And so for most people, that is, or for most employers, that is masking, that is testing, that is social distancing, that is working from home, that is washing your hands. Those are the basic ones. And so, to have a religious exemption against masks and testing, the masking, I just don't see the argument there. The argument that I've seen out there is, well, people wear shawls, people wear yarmulkes, people wear things. And so my religious beliefs are that I can't cover my face. So you telling me you've never covered your face, and if it was freezing cold, you wouldn't cover your face, kind of thing. I just think you're pushing it, and I don't think you can. I also think that, if you aren't masking and testing, what is the accommodation to keep your other employees safe? And you have to realize they're coming from a public health perspective. You're not going to argue them on masks don't do anything, on testing doesn't do anything, there are false positives, all of those things. So what is your accommodation? Are you willing to stay from home, work from home? Can you work from home? If you can work from home anyway, then my guess is you may as well ask to work from home, and you won't have to deal with the masks and the testing. Any information about ingredients of upcoming boosters? So the booster shots are all the current vaccines. So Pfizer and Moderna are the ones that have put forward a third booster shot, and J&J has not put out another booster shot. So they're still at one vaccine. Okay. Next question. Do you think that Senator Pan or the medical board will be attacking any more doctors who may be writing medical exemptions for COVID vaccines or writing exemptions for mask wearing? They've already done that. There was a email that went out yesterday to all physicians on the medical board, from the medical board, saying that if you're writing exemptions for mask wearing, be careful because you may be disciplined for it. There's a witch hunt on. There's a witch hunt on for both of those. I think the doctors, I don't think it's Senator Pan. I think it's more the medical board at this point, or CDPH. But yes, absolutely. You can't get a medical exemption in this state. If you want, the other, I'm going to say stupid thing is that, for example, there's a school in Roseville where a huge number of kids have mask exemptions, and they were all written by the same doctor. Well, that just puts a target on that doctor's back. I mean, I honestly look at those parents that did that, and I'm pretty sure they all knew that they were getting them from the same doctor, because some parent went, oh, I went to this doctor and got a medical exemption for a mask. But you're putting a target on that doctor's back. I mean, we know that medical exemptions are a witch hunt for whatever they are. Do you think interstate travel could get blocked, made harder with these vax mandates, meaning blocking or restricting travel from, let's say, California to Arizona or Texas? There is a bill on the federal level in Congress that would restrict interstate travel to only the vaccinated, or if you have an exemption. So the answer is yes. Do I think states such as, let's say, Florida will leave their borders open for everyone? Yes, I do. Do I think it's going to be hard for California? I think if you reside in California, you'll be allowed to come back in. But if you don't reside in California, could I see that happening? Yeah, I could. It's a federal level bill, so it would apply to all states. The question is, what states are gonna say no to it. Are there any places that do not report positive tests to public agencies? Any idea if they also report to school or employer submitting the test results to a school? If the first test runs out positive, and if one is completely asymptomatic, is there a way to retest to hopefully get a negative result to use in the school? Are the labs testing places open to doing that? So if you get a positive test, my answer is to immediately go get a second test and to see whether you are positive. And if it comes back negative, then it's likely to be a false positive. I would then actually go and do a third test and just check it again. They do have to report. So I don't know if the lab has to report positive cases to CDPH. That's part of the law. I don't know that they have to report it to an employer or a school. I think it's your responsibility to do that, but they may, in contact tracing, follow that. So I do think they have to, but I think, the argument hasn't been made for this whole false positive thing. I think if it were me and I came back positive, I would go and get another test and another test. And, if the second one came back positive, I would take it that I'm positive. But if it came back negative, I would get another test to get to negative. And then I would use that as an argument. I think it's an argument that needs to be made, but it hasn't been made conclusively yet. Okay, is it possible to become a part of any group for the saliva clear test, even if it is a small group that is ready to share costs? I would be interested. Gather they need the max of 24 people for testing, so the cost varies between $360 to $15. I would recommend, on places like Stand Up California, I think there are other people, like if you take your county, you have to be in the same area because you have to get all the tests together the same day and then ship them off. So, my recommendation would go on to Stand Up California county, your county, and put an email out there and say, I need to test for work. Anyone else want to do saliva testing, and see who you can get together, or if you know of other local groups that there may be people. California valid medical exemptions for kids 7th grade to 12th grade submitted on time in 2019, accepted valid in 2019 to 20 until virtual learning from lockdown on March 2020. Should still be valid now that the school is in person for fall 2021. Why is it now deemed invalid? Is January 21 SB 276 invalid dates an exemption written before 2021? So there could be a few reasons for that. Number one, when you say you went into virtual learning, did you remove them from school, or was it virtual learning through the same school? If you removed them from school and homeschooled them and filed a PSA, then that's the reason why they're no longer valid, because you're considered a readmission now this year. The other thing that happened in the beginning of the summer was that CDPH finally implemented, there's a clause in SB 276 that says any doctor that has been disciplined, that they're ever in their life for whatever reason, that their medical exemptions are revoked, that they're no longer valid. And so if your doctor ever had a disciplinary action, then they would have been revoked. If you don't fall into either of those and your children were in school, enrolled in school, and your doctor hasn't been disciplined, then they should be valid, and email me, and I'm happy to try and help you. Okay, in a prior talk, you said that the vaccines have not been studied for carcinogenic or mutagenic effects. Can you let me know where I can find this information in writing? So if you look at any vaccine information package, section 13.1 states that. For the COVID vaccines, you would go to the EUA summary on the FDA website, and it also states that. Okay, I heard on another webinar that giving religious exemption is also giving up your rights. It was suggested the best way to get out of this system is out of the system. So yes, I agree, get out of the system. I don't believe that giving a religious exemption is giving up your rights. It's actually, I would say, the opposite. You are standing on your First Amendment rights. So that's where it comes from. So if you believe in the Constitution, having a religious exemption is your number one First Amendment right. Okay. I was told that teachers who cannot get the vaccine will be fired because they work with the public and they are seen as a hazard to the public, even if a teacher has a medical exemption. Is this true? I don't think you can be fired if you have a medical or a religious exemption for that reason, for not getting the vaccine, because you would have a religious discrimination or a medical discrimination lawsuit. Where can we find the new exemptions for parents to the California health order that limits visitors to hospitals, patients to people who are vaccinated or test negative? So this was an order that came out on August 5th. On August 11th, CDPH put out a letter to the healthcare. It was a general letter to all healthcare facilities that said to the order said that anyone going into hospital has to either be vaccinated or test negative if you're not going in for an emergency. If you're going in for an emergency, you don't have to, but anyone who's visiting you does have to show either a vaccination or a negative test. There are exemptions. So Educate Advocate, which is an amazing organization that we work very closely with, they have been sending letters to CDPH constantly on different things to make sure that exemptions, they're a disability, they support families with disabilities, that disabilities, children with disabilities and adults with disabilities, that the exemptions are there for them. And so they wrote to CDPH, and CDPH sent out this letter to all facilities saying that pediatric patients, disabled patients with AIDS, and a number of other people, if you are visiting in that context, that you are exempt. If you go to Educate Advocate's Twitter page, it's educate.advocate, or maybe Educate Advocate CA. But if you go to their Twitter page, it is on there, the letter. They have posted the letter on there. They've also asked CDPH to put something on the order or a link from the order that shows those exemptions. I do not believe CDPH has done that yet. I'm in my mid-40s and want to conceive. I'm concerned about the requirement because I've heard miscarriages after the jab is high. That is true. My recommendation is to go to your OBGYN and see if you can get a medical exemption. Some places have say that for medical reasons, if you are pre-pregnant, i.e. looking to conceive, pregnant or breastfeeding, that you don't have to get the vaccine. Although I think that's going to change soon because the CDC just came out today and said it's fine for vaccinated people. The vaccine is fine for pregnant people. This question is, my question is not about the COVID vaccine, but about regular vaccines. Dr. Kennedy issued a medical exemption to our daughter in 2019. She's now transferring from one private high school to another one in 10th grade. What's the best approach to get her through at least high school without being vaccinated? So Dr. Kennedy was disciplined. And so his exemptions are no longer valid. If you are transferring from one private high school to another, they may not realize that and they may not implement it, but you run the risk of it being revoked and she won't be able to continue with school. At that point, she has to be vaccinated. You have to homeschool or move out of state, unless she has an IEP. If you have a special needs child on an IEP, then they are exempt from the vaccination requirements for K through 12. If Newsom is recalled, will his vaccine mandate for teachers, etc., be thrown out? So it would require the new governor to throw them out, but many of the candidates have said they will not mandate vaccines. Doesn't mean to say it wouldn't go through the legislature next year, but they have said that. The other thing is that most of the candidates have said that they would stop the emergency state of emergency in California based on the pandemic. So if the state of emergency is removed, then all the orders that were put in place under the state of emergency go away. So that's probably the biggest key thing, is to remove the state of emergency because of the pandemic, and then all of these requirements, all of these orders go away. Answer that question. So somebody asked about the travel again and then said, what about banning these people access to even grocery stores, banks? So I go down the worst possibility, or one of the worst possibilities. I think there will be recourse. I think there will be court cases where possibly, things like buying groceries, which is your basic need, you wouldn't need to be vaccinated. but you look at China. Like if you haven't looked what's happening in China, go look at what's happening in China regarding their credit score system. So everyone has to have a phone with the app on it, and your credit score, your social credit score is on there. Everything is AI. They know exactly where you are at all times. And if you don't do something right, your credit score plummets and you don't get to do extra things. You don't get to travel. You don't get to put fuel in your car. You don't get to get on transportation. You don't get to do things. And so the whole point of it is you can't function in society unless your credit score is high. How do you increase your credit score? You increase your social credit score by doing good things like getting vaccinated, like getting tested every week, like getting, all of those things. Do I think that's a possibility? Yeah, I think it's a possibility here in California. Do I think it's a possibility in Florida? No, I don't think it's a possibility in Florida. But do I think it's a possibility in California? Yeah, and it's the direction we're headed. I hope not. I hope I'm wrong. I really, really do. But do I think it's a possibility? Yes. Okay. Are the COVID vaccines different mRNA technology than traditional vaccines, IPV, MMR, from the perspective of risks? How do we weigh the risks of vaccinating our 16-year-old against the risk of COVID in the light of the Delta variant, which has an impact on the younger segment and is more dangerous? What holistic alternatives exist? I am in California and our kids are not vaccinated. Thanks. So if your kids aren't vaccinated, you've clearly made the decision that the vaccines have greater risk than the disease. My recommendation for anything on this front is to weigh those risks and benefits. So what is the risk of your child having an adverse reaction from an mRNA technology vaccine? We have no idea because the clinical trials haven't finished. And even with the clinical trials, they've gotten to a point where they're meaningless because there's no placebo in the clinical trials. So you can't look at safety and efficacy. You can look at efficacy, but you can't look at safety. From a long-term perspective. So we have absolutely no idea. What you need to take into consideration is the unknown of fertility, the unknown of cancer, the unknown of autoimmune disorders. Then you need to look at who is your 16-year-old child? Are they healthy? Are they likely to get COVID? So the chance of getting COVID at any time in the population is somewhere between 2 and 4%. That means 96% of the people around you don't have COVID. Many of those 2 to 4% that do have COVID are in the hospital or at home because they're sick. So the chance of anyone getting COVID is actually extremely low, unless you're in a place where somebody has COVID and you're in a group or something like that. But just going about your daily life, it's quite low. The other piece is how many other people around them have the vaccine. Not that helps with the Delta variant because it's transmitted by people who are vaccinated as well. But you need to look at the risk to benefit. I personally am not, one of my children, I'm 99% sure had COVID in December of 2019. But I am pretty sure that my kids would survive COVID. I am not afraid of COVID. I personally think there is a higher risk of something happening to them if they get the vaccine than there is of if they get COVID. I also believe that the immunity you get from the COVID disease is much longer lasting than any of these vaccines. And so, but that's me from my research. You have to do your research and you have to work out, you have to weigh those risks and benefits. Is the Delta variant impacting more young people? Yes, it is, because those are the people that are currently being tested. Older people are not being tested anymore. The younger people are being tested in schools and things like that. The other piece is those are the people that are not vaccinated. So they're going to show more symptoms. Are there kids in the hospital? There are. But I look at, I read an article yesterday. Somebody sent it to me. It was in Arkansas. There is only one pediatric ICU and the beds are full. There are only 2 beds remaining. And so, I'm a statistician by nature. So I'm like, okay, let me look at this. Number one, how many beds are there in this pediatric ICU? Well, there were 26 beds. That means that about 10% of the beds, 8% of the beds are empty. Well, when you're running an ICU, when you're running any business, you want to run it to its highest capacity. So being 92% full actually isn't that bad. If you were running an ICU, which was 30% full, your business would be down the toilet. So you want it to be full. Then I looked at out of the 24 kids that were in that ICU, how many of them had COVID? Well, less than half of them, 10 of them had COVID. The other 14 had RSV and other things. Well, you can't tell me that the ICU is full of COVID, kids with COVID, if only, less than 50% of them have COVID. So, and then another, in the same article, it said, I think 1,600 kids have come down. I don't know whether it was with the Delta variant, there was some number, but we have 69 million children in the US. Whatever that number was, even if it was a weekly number, with 69 million kids, that's like a tiny percentage of those kids. So, look at the numbers and look at the real numbers. Don't just take the headlines, because the headlines are all fear-based. Okay, what holistic alternatives exist? I would look into, if your child got COVID, how would you treat it? And how can you prophylactically? So things like vitamin C, vitamin D, zinc, boost them up with those. Again, I am not a doctor, so I'm not giving medical advice, but that's what I would do with my kid. Okay, next question. My employer, fire department in California, is telling me that a religious exemption places an undue hardship on them since they're required to find a reasonable accommodation and not a preferred accommodation. So yes, this is a piece of law that and I'm going to answer this really, really limited. Go to my workshop because I go through this. So the question of reasonable accommodation. A reasonable accommodation is that you are in the same possession without being a public health threat to the other people there. Well, if you believe in public health, masking, social distancing, washing hands, testing, all of those would be reasonable accommodations. So I do believe there are unreasonable accommodations that some employers are putting on it. So will religious exemptions work for travel mandates? I don't believe they will unless they put one in. This one is on a religious exemption. Should I hand it in now or when it's due? So unless you're feeling threatened and you feel like they're going to fire you for some reason, my recommendation is to wait, but I wouldn't wait till the last day. I would put it in, maybe 3 or 4 days in advance just to make sure it's uploaded correctly or whatever, because you don't want to be the last minute trying to get it uploaded and you don't get it because it didn't get into the system. What state would you suggest at this point to move to, given the fact it will get worse before it gets better? I think there are very few places. I would look at, so one of the key things for me is to look at either, unfortunately, it is a partisan issue, so a Republican state, or at least a state that has a balance of red and blue. States, South Dakota, North Dakota, Idaho to some extent. Texas is turning. I think it will depend on what happens there. It depends on who will be the governor there. Florida. Then there are states that are sort of have stayed out of it. Things like Virginia, Kentucky, Tennessee, that have kind of like, they're not in the news because they've just sort of stayed out of the fray. But my big thing is you need to find somewhere that you feel comfortable living. Like I would go and visit them and decide if that's a place that you want to live. I mean, I went to Florida over the summer and oh boy, it's humid in the summer there. Not that that would stop me from living there, but it's just something to take into consideration. So will exemptions be allowed for health passes? Possibly. So I know New York City, for example, I did call New York City and I asked them if I pretended to be a place of employment, a restaurant or a business. And I said, if I have somebody who comes in with a religious or medical exemption, can I allow them in? The New York order has an interesting line. It says, you're allowed to make accommodations as long as they are, they take public health into consideration or something like that. And I was just like, what does that mean? They told me that in the next week or two, they will have, before September 13th, when it becomes enforced, that they will have a medical and religious exemption section piece of it. And so here in California, where this is getting passed through, like by the city councils and that type of thing, one of the things that we are doing is requesting that a religious exemption and a medical exemption or natural immunity are included as options to that. And I would recommend you going to your board of supervisors, your city council, and demanding that as well. Okay, I'm really confused because I've heard that all of this is really illegal because none of these restrictions, mass test vaccines, are law. Even the governor, mayors can't mandate anything unless it's been legislated into law. Do we just have to win a few cases in court on those grounds that there is no emergency to set precedent so that this doesn't ever happen again? I'm not in California, but I think this is a general US question. So this really depends on the state you're in. So in California, our statute says that during a time of emergency, the governor has powers and can make any order as if it's law. We also have another law in California statute that says that local public health officer can take any action they deem necessary in the time of an epidemic or a potential epidemic. An epidemic is 3 cases or potential epidemic. So basically our public health officers can do whatever they want, and what they do is equal to the law. The same with our governor. Now there are other states, I think Illinois may be one of them. I don't remember where the lawsuit was. It was somewhere Illinois, Michigan, or Ohio. But their statute said that that the governor's orders during a state of emergency don't hold as much weight, and or that they can't have an ongoing state of emergency. So here in California, our state of emergency ends when the governor says it ends, or unless the legislature says that they are ending it. But there's no defined date. In some states, a state of emergency can only go on for a certain number of days, and then you can't have a state of emergency anymore, or the governor's orders don't apply. So it really depends on your state, the answer to that. I'm just going through, I answered many of these. Somebody asked, what country would I move to? My mother lives in Switzerland, and I never realized until I talked to her a few months ago, the democracy in Switzerland. And it's not only, it's incredibly expensive. I wouldn't necessarily live there, but the democracy is amazing. So every single person is registered to vote if you're a citizen, and they have a parliament that has people from each county, from each canton, and they create bills, but there is no governor or president or prime minister or anything at the top of that. Every single bill, budget, health, everything goes onto a ballot every 3 months, and they vote on every single law, and they have to get 50 plus 1%. And so it is really up to the people to pass. It's like having a whole bunch of initiatives, but it's up to the people to pass it. So I'm like, why can't we have that in more places? So somebody asked about accommodations. Again, I would recommend coming to the workshop. The key with accommodations is it should be your employer that supplies the accommodation. So when they have a religious exemption or medical exemption policy, they should also with that say, if you have a religious or medical exemption, you must mask, you must test weekly, you must do whatever. That's why the California health order has that in. If you are vaccinated, or if you have if you have a religious or a medical exemption, you have to test weekly. That's your accommodation. Do you believe breastfeeding is a good enough excuse not to get vaccinated? I think it can be. It's up to your employer. I would ask them. I would say, I'm breastfeeding. I don't feel comfortable taking the vaccine right now, and see what they say. There's one here that I'll read just because I'm laughing or I'm smiling at it. Christina, you're an angel. Thank you again for all you do. Superhero status for certain. Thank you. And I will say it, I say this in my religious exemption group workshops. I do this because of you. I don't get paid for it. If anything, I put thousands of dollars into a voice of my own money into a voice for choice advocacy. I'm just extremely passionate about this, and I am horrified, honestly, to see our liberties and our rights being just washed away and no one really standing up for them. It amazes me where we're at, but yeah, no, I do it. I do it for people like you. When is the soonest you foresee COVID vaccines being mandated for K through 12? I think they will be mandated, if I had to guess, and they are mandated, I would say 7th grade and up. For the next school year, possibly it would have to be emergency. It would be harder because they'd have to get a 2/3 majority. So I think 2023 school year, but it could go into effect 2022 if it's pushed through. Again, it really depends on who our governor is. Okay. How can we address teachers mentioning vaccinations on a daily basis to students? To me, it's harassment, but how do I handle it? I agree with you, it is. I think it is incredibly hard. If you talk to principals, which I have done, their answer is, well, we're just doing it because public health is telling us to do it. I think if you phrase it in a mental health way, you may be able to have more of an impact. So to me, COVID has had a huge mental health impact on children, not just because they weren't in school, but the fear and the constant talk about COVID, the fact that they have to wear masks, they are constantly reminded of this thing. And to me, if you went to a school and said, or went to a teacher in particular and said, look, I understand that vaccination is important, but at this point, especially in California, everyone who wants the vaccination has gotten the vaccination or has access to the vaccination. And so, from a mental health perspective, can we kind of take a step back and can we not focus on it as much, because it is causing intense anxiety and mental health, issues. I think, if it were me, that would be how I would address it. In California, my union was avoiding question about negotiations about vaccines in the workplace. And when they finally responded, they said they do not have a right to negotiate vaccine terms, and the district has a right to demand whatever they want. Is this true? No, no. So the reason you're part of a union is because of collective bargaining rights. That's the whole, to me, that's the whole point of being, I don't know much about unions, but that's the whole point of being part of a union. And so they absolutely have the right to negotiate. My recommendation is look up CEMA, is a union of, I believe, teachers or employees in a school district in the South Bay, San Francisco South Bay area. They have filed a cease and desist. The SEIU 1000 has filed a cease and desist against Newsom, basically saying that you can't put this in place. You have to do collective bargaining. You have to bargain. And so I would look at those and share those with them and say, look, you do have a right to, you do need to negotiate this. Some doctors are reporting 500,000 deaths from the shot. Is that a true number? I don't think we have any clue on any numbers. I don't think we have a clue on any death rates, injury rates from the vaccine. I don't think we have any real numbers on the death rates from COVID. And I say that because they're all could be underreported. They all could be overreported. You look at VAERS, anyone can put a adverse reaction into VAERS. All of us could put one in tonight. I also think they're completely underreported. If you think about that second vaccine, sorry, not that second vaccine. If you think, no, it is the second vaccine. So if you think about the hype when people were getting the second vaccine, it was, you're going to feel like shit for 2 days. You're going to feel like absolute crap. Don't worry. That's how you're supposed to do. That's how you know the vaccine is working. Blah, 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 blah. None of those people who felt like crap I'm pretty sure entered anything into the vaccine reporting system, because they were just like, this is what I'm supposed to feel like. So is there underreporting? Yeah, there's underreporting. I think there are other people that have died of other things and have been counted as COVID deaths. So I think the numbers are all up for grabs. So do I think it's as high as 500,000? I don't think it's as high as 500,000, but it's because we haven't had 500,000 deaths in the US, but do I think worldwide? Possibly. I just don't think we know the numbers. Okay. I'm active duty Air Force with the DoD's pending mandatory COVID vaccination program, either under POTUS waiver to informed consent or after FDA approval. I intend to pursue an exemption so that I do not have to disobey what would be considered a lawful order. What advice or recommendations do you have based on your experience? So for the military, it's hard. It's hard to get a religious exemption. My understanding prior to COVID, although I've done much more research now, was that you could only have a religious exemption if you stated that coming into the military. And after that, you'd basically signed your life away. Having said that, having done more research now and read all the military code, my understanding is that you could request a religious exemption of your next in command. They would have to approve it. You would have to speak to a medical doctor within the Air Force, if you're in the Air Force, and you would have to speak to a chaplain, and all three of them would have to approve it. Do I think it's possible? I do think it's possible. Do I think it's been done? I don't know of anyone who's done it. So you're going to be the guinea pigs on those, but I'm happy to help them. I have an unvaccinated child at home this year. She can qualify for an IEP, but I haven't wanted to place that label on her. If she wants to go to high school next year, would she be exempt from all vaccines, including COVID, if she did have an IEP? So the answer is yes for all vaccinations. For COVID, we need to, my guess is the answer is yes, but it becomes a question of what the legislation says, what the statute says. Is there an expiration of a religious exemption? No, there isn't. Some employers require you to submit it every year, but there isn't an exemption, and it can cover, if your religious beliefs cover all vaccines, it can cover all vaccines. If they just cover, for example, aborted fetal cell lines in the vaccine, then it would just cover the ones that are that include that. What can you advise for parents needing childcare for an unvaxxed toddler? Find a home group. Other people, same age, in homes. Find a nanny that will cover many kids. It can't be considered a childcare program, so it can't be, you drop a kid off at one person's house every single day, because that would be a childcare program. But if you had 5 of you and you each took turns in different houses every day, that counts as kids going over to a friend's house. Would I consider mask mandates, weekly testing, or travel restrictions for non-vaccinated people health discrimination? So you have to, in order to discriminate, you have to fall into a protected class. There are some medical genetic issues that fall into that, but it wouldn't necessarily be considered health discrimination, especially if we're in a pandemic. In a pandemic, public health trumps your rights, unfortunately. I hear that California does not recognize Title VII. Is this true? No, it's actually supported in or underlined in California by the Unruh Civil Rights Act, which is the California version of the Civil Rights Act, so no. Do you know of any states that prohibit private companies from mandating the COVID vaccine? I do. I believe Texas is one of them, but don't quote me on that. Where I would go for that is righttorefuse.org. They have all the states and what legislation has been passed in each of the states. So if your child is moving within grade spans from school to school and the medical exemption is valid and not written by a disciplined doctor, yes, it will transfer. If you have issues with that, some schools don't understand that. If you have issues with that, let me know. Why are they putting so much on these experimental vaccines? How come these mandates are happening in the first place? Well, if you want to go down the conspiracy theory lane of that, because they want everyone to be vaccinated. Could it be eugenics and the depopulation? Could be. And go to the World Economic Forum if you want more information on that. Could it be that they've injected you with some nanoparticle that will allow them to control you by AI? Yep, you can go down that route. Could it be that they just want everyone to be vaccinated? Could be. Is it money behind it? Most likely. There's lots of different reasons why it could be. You have to do your own research and work that out for yourself. Are there pending lawsuits about the COVID vaccines? If so, when might we know their outcome? So there are pending lawsuits. They're mostly based on the emergency use authorization, that you can't require a vaccine under emergency use authorization. Come September, those will all be moot because Pfizer will be approved. There are others based on, for example, there's the University of Indiana students that are saying that the vaccine requirement, the alternative is, and actually in LMU, the Loyola Marymount, that the vaccine requirements, the accommodations are too strict for them. So there are various ones that are out there. There's the Houston Methodist nurses. There are some out there, but for the most part, I think we will get a ruling from the Supreme Court on these, and I think it will be a toss-up whether they will go in favor of the Constitution or public health. If my teen shows she has COVID antibodies, doesn't that mean she's intact, immune, doesn't need the vaccine? So they're not recognizing titers or antibodies. I do believe that should be the case. You could go to a doctor and ask for a medical exemption based on it. But the CDC is saying that you should, if you haven't been if you have had COVID, you should still get at least one shot of the vaccine. So that, it doesn't really help you there. Okay, if you have a daughter attending a university with only options for a medical exemption, but the teachers are allowed a personal religious belief, send me the email with the policy, because we have a letter that demands that the university accept the religious exemption, because it becomes religious discrimination. So definitely send me an email and let me know that information. Do you think Senator Pan will be putting together any more lists of doctors that will end up invalidating childhood medical exemptions? So it wasn't Senator Pan, it was CDPH. It's under SB 276. It's part of the statute. They will, I believe, update those every time somebody gets revoked or somebody gets disciplined, and they will update them, or they will tell the schools to go look on the medical board website. Who pays for weekly COVID testing if mandated by the school? So the school often will cover it, or sometimes you're made to cover it. Benefits, drawbacks of a home antigen test. So an antigen test usually is a rapid test. It has a much higher rate of false positives. So you do want a PCR test, even that has higher rates of false positive. If you want to get rid of false positives completely, you want to do sequencing tests. There aren't that many out there, but there are definitely labs that do sequencing tests, and they're not that much more expensive. They're not more expensive than a PCR test. They take more time, but they are 100. They actually sequence the genome, so they were 100% accurate. Okay, and my son has an accepted religious exemption. In the event of an outbreak, when the school could exclude him from campus and class if he gets coerced into taking the shot in order to stay in class and he gets injured by the shot, can I sue the university for damages? Or are they considered protected under the PrEP Act or other protection? So I believe you do have a case. The key is, can you prove that the injury is from the vaccination? And that's the hard piece to do. But I do think if it was really obvious and you had doctors backing you up, or ER, and if it happens, I would make sure everything is documented in the ER or whatever happens. I think if it happens immediately, for example, if he has a stroke or if he has brain swelling or if he has myocarditis or Guillain-Barré or something like that, I think it is more likely that you could sue the school. But if it's something longer term, like you think it's an autoimmune disorder or something something that appears 2 weeks later, I think it would be a lot harder. My husband's company is saying that they need to be vaccinated to go into the office, and if they don't, they won't get merit increases. So it really depends on what his contract says. So I would look at his contract. If there's nothing in there about his contract, it's a private company. They can basically do whatever they want to do. I am a steward in my union and want to support my members that are not vaccinated, but my union has a very progressive approach and does not want to fight for the 20% that do not want to get vaccinated. What do you recommend in this situation? I'm not well versed on unions. What my understanding, or what the argument that I think you could make, is that a union has to represent all of its members. Are they willing to let those 20% go? And no longer, have them basically walk out of the union? Probably not. My guess is that they pay a decent amount of dues. But, my understanding is that our union needs to represent all of its members. If it has that many members that are on one side of things and other members on the other, then it needs to either stand up for the underdog, stand up for the smaller people, or needs to at least not take a stand on it. So as I said, I'm not familiar with exactly how unions work, but that would be my argument. I'm a licensed psychotherapist at a master's level. I have a private practice in California. Am I part of the mandates for healthcare workers? I do not want the vaccine. I do not want to be tested. What are my options? So my understanding is you have to be part of a doctor's office or clinic. I've asked CDPH for a definition of that, and what is it if you work for yourself. My understanding is you're not reporting to anyone, so you are basically in charge of yourself, and so you can give yourself a religious exemption or not be tested. Is asthma a strong enough diagnosis for a medical exemption for the vaccine? No, it's not in most cases. Do you think schools will require weekly COVID testings for children that didn't get the shot? Many are requiring that. My argument for that is everyone should be tested. I don't agree with the testing, but in my opinion, everyone should be tested because of the Delta variant, and it's transmitted by vaccinated and unvaccinated. Now, schools don't particularly want to pay for 1,000 kids to be tested versus the handful of kids that are not vaccinated if you take a high school or something like that. So I don't think you're going to get an unvaccinated kid not testing, but you may require everyone to be tested. The reason why I like that idea is that it will show how many more breakthrough cases there are, that the vaccinated are actually getting COVID. Right now, the vaccinated are not being tested. And so the breakthrough cases are not coming through as much. A college is required to provide online instruction if they deny students access to campus, such as denied exemption or quarantine from contact tracing. If you are a public school, like the University of California, I don't know whether they have to, but I believe they are. If you are a private college or university, I think it's up to them what they want to do. Do you think the multiplicity of lawsuits has a chance to stop these unconstitutional actions restricting our rights? I don't in California. I don't in California, New York, those places, the legal system is just as biased as the legislative system. Do I think something will come up to the Supreme Court and be addressed by the Supreme Court? I do. The real question is how they rule. I think it's a toss-up. If Newsom resigned before the recall, would the lieutenant governor, also a Dem, be made governor, and would the recall be stopped? Somebody asked me this question and I haven't looked into it. My understanding that, so if Newsom resigned before the recall, yes, the lieutenant governor would be made governor, but I'm not sure if the recall would be stopped at that point. I don't know the logistics of that. I believe my understanding is that the recall is happening. And so I don't think so, but I honestly don't know the answer to that question. Can we ask the CDC to prove that the virus was isolated and prove the pandemic exists? So this is an interesting one. This stems out of the guy. I mean, it's been an argument throughout COVID that COVID has never been isolated. And, the answer to that is the COVID virus has been isolated in the same way as any other virus has been isolated. So if you don't believe the COVID virus has been isolated, then the measles virus has also not been isolated, or the flu virus has also not been isolated. They have done the same thing with the COVID virus, and they being not the CDC necessarily, but there are, let me put it this way, there are tests that sequence the virus, and they're sequencing something from people who have COVID that is this virus strand, and they're sequencing the whole virus strand. So, my perspective on this is, if you're going to say they haven't isolated the COVID virus, the COVID virus has not been isolated by anyone, then you are also saying that no virus has ever been isolated, because they've used the same process to isolate the COVID virus, and it's not perfect by any means, don't get me wrong. But they use the same to isolate other viruses. And so at that point, you're going to viruses don't exist, and you're in sort of terrain theory area, which, you could believe that too. What are your thoughts on joining street protests to protest city council mandates, such as the one coming up in LA, not permitting entry to business for the unvaccinated? I have very mixed feelings about street protests. I wish millions of people would rise up. So when I look at, places in Europe where you see people just coming together, I think it is amazing. And I think that absolutely should happen. The issue is smaller things like city councils. If you can get thousands, tens of thousands of people there, then possibly yes. The problem is that there are people planted in these. I look at things that have happened to the anti-vaxxers, the anti-maskers, I look at the end of the session in 2019 when the woman threw her menstrual blood on the Senate floor. Nobody knew that woman from our movement. And, was she planted there? Possibly, but it looks bad on us. Senator Pan keeps saying he's being harassed by anti-vaxxers. Could they be people harassing him? Sure, they could be people harassing, but it's really easy for the other side to put 10 people into a crowd and, you know, get out guns and get out stuff. And so I really have I have mixed views on this. The other piece is, so, you know, if you can get thousands, tens of thousands of people there, yes. But if you're just a few people, you know, I look at, there was a protest in Marin where there were maybe 100 people. It was Jared Huffman, a congressman. He had a town hall and he was saying that only vaccinated people could come in. Now, 99 of those people were calm. They went there with the purpose of being calm and just protesting outside, showing their, you know, holding signs, that kind of thing. But then there was one woman, they did actually go in, and there was one woman that pulled down her mask and pulled other people's masks down. Again, they had no idea who she was. They'd never, most of the people or nobody knew who she was. And so, you know, was she really part of that movement, or was she somebody that was put in there? Of course, the news that evening only covered her and was just like, these anti-maskers, you know, anti-vaxxers, they're attacking people, they're pulling people's masks down, they're trying to make them sick. You know, she stuck her tongue out at in this person's face with the mask down. So long answer short, I have really mixed feelings about street protests. I think if they are large enough where the majority of people are, you know, moving in one direction, then yes. But I just, and, you know, I look at the irony of the Black Lives Matter protests that over, you know, summer 2 years ago, where, you know, we were in the midst of COVID and, you know, looting happened, protests. I mean, it was horrible. It was ugly, and nothing was done about it. If that had been a anti-vax mandate or a anti-mask protest, you can guarantee it that everyone would have been arrested. There would have been huge, you know, you would have been fined for looting, all the rest of it. And so I I guess my answer is just be careful, because it's a double standard. My employer is requiring color-coded lanyards to designated vaxxed and unvaxxed. I feel this is going to be a lot of discrimination. What legal grounds do we have to protect ourselves from segregation? The worst example I had of this was the Wholesome Pistachio and Walnut Company. They were requiring their unvaccinated people to wear yellow vests and a yellow badge. Does that say anything to you? I think lanyard stickers, I would go to them and say, you know, have you thought about the legal ramifications of this? This is really segregation. You know, I hate to use the you know, Nazis and the yellow stars, but that's what I'm feeling like here. Often employers haven't thought about it. Now, there are definitely some employers that have thought about it and are quite happy with that. I think just bringing it up and seeing where they sit, I do think it is segregation. I do think it's a dangerous path to go down, but there are employers that don't care and just want to shame the unvaccinated. And do I think there could be a lawsuit over it? I do. I think it has to be a really good lawsuit. Can you ask an employer or a college to sign a document that they are financially responsible if the individual can get a reaction or develops a disease after the vaccine? You can. Will they sign it? No. So, I mean, go for it. It's like there are forms out there that say, you know, have your employer sign off on, you know, that they've given you all the side effects, and they've given you all this, and they've given you all that. There's no employer that's going to sign that. Why would they sign it? So can you be told to stay home if you've been exposed and you've been vaccinated, or you've not been vaccinated? Yes, that's just part of the system. I would make the argument that right now, and it's not, you know, if they follow public health, it's not the way it goes, but that the vaccinated should also stay home because they can transmit the disease. What's the risk of getting prion disease for the next year or two from the vaccine? Some doctors think that most people will die of prion disease in the next year or so because the vaccine ingredients have passed through the blood-brain barrier. Your opinion? Do I think it's possible? Yes. Do I have any evidence one way or another? No. You know, I don't think the research is done. I think anybody who says that doesn't have evidence to say it. Is it possible? Possibly. I think there's also, you know, cancer, infertility, lots of other things that could be possible, but I don't think we will know until it happens. And at that point, it's too late for most people. So is it true that the J&J vaccine will soon be disqualified from being an approved vaccine that will rectify requirements for vaccination? Possibly. They may not get approved for, but, you know, fully approved by the FDA. There are some people that say that the J&J vaccine will be thrown under the bus. It was there as an alternative, but it will be thrown under the bus for the other vaccines. I think that is possible. I think anything's possible. It's all money based. Okay, we were told by San Jose Unified that an IEP does not exempt student from vaccines. That is absolutely incorrect. If you have that issue, my recommendation is to get in touch with Educate Advocate. As I said before, they're an amazing organization that helps special needs children and adults. Their website is educateadvocateca.com. It's not .com, it's .org, but I think it's .com. Can I exclude the school for discrimination if they only require testing for unvaccinated students? No. Or you can try, but I don't think you'd win it. My son's school is requiring signing a waiver for a rapid PCR swab test on a weekly basis. Can I demand only a spit test as a substitute? You can try. Yeah, it's up to them whether they allow it. Can they do testing without parental consent? Yes. If they're high school students, I would say yes, they can. You can argue that they can't. You know, basically 14 and up. I don't think you would win it in court. Let's put it that way. What is my assessment of the possibility of a recall of Newsom? Do you have confidence in the election will be fair? So I think the election, and, you know, could there be a whole load of corruption? Yes, there could. So I'm just going to put that out there. Do I think the election could be fair? I do. The issue is that it's a mail-in, you know, everyone gets their ballots in the mail. The problem with that is that everyone has a ballot to get in. So do I think there will be ballot harvesting, which is when people go door to door and pick up other people's ballots to take to the polling station? Absolutely, yes. 70% of our electorate, the registered voters in California, are Democrats. That means 70% are Democrats that have a ballot in their home. So the real question, if it was just going to the polling station, or, you know, people who have mail-in ballots, which was a very small minority of people, if it was going to the polling station, I think there would be a better chance, because the people who are pissed off are the people that are going to go. With having a mail ballot available to absolutely everyone, I think it is much harder, because it means that everyone, you know, can easily put their 2 circles on it and mail it in. So the chance of Newsom being recalled, I think the polls are about right. I think it's 50-50. I think it will be extremely close. I think it will come down to, you know, I will say, if there is nothing else you do in the next 3 weeks or 4 weeks, if there's nothing else you do, go do something for the recall, get the word out, go do phone calls, go walk precincts, go get the word out, even if you just do your friends and family, you know, get as many people voting yes on the recall as possible, because that is what will change California in the short term, at least put a stop on things. Okay. Can a student be dismissed from school or college in case of exemptions not approved? Yes, they can. Okay, if you do ask for any type of exemption, you're legitimizing the mandate. So essentially you're giving up your rights. And once you submit an exemption, they can add you to the list of dissenters. So let's just be very, very clear. In the state of California, everyone who's getting a vaccine is in the immunization registry. California already knows. I mean, we had the lottery that was based on vaccinated people. They didn't call you up and ask if you were vaccinated. They knew who was vaccinated and who's not vaccinated. You're already on a list of not. If you believe this is the case, which, yeah, I think very well could be, they already know who's not vaccinated and who's vaccinated. So you're already on a list. Let's just put it out there for that. I would argue the opposite. If you ask for an exemption and you file exemption, you are standing on your First Amendment rights, your religious exemption rights. If you don't file an exemption, that's fine. You're going to get fired. So go find a different job. Get out of the job you're in. If you truly believe that, then you shouldn't be working for somebody that is requiring the vaccination. Go find a job, work for yourself, whatever you want to do, but don't work for that employer. So yes, if you're willing to just say no, and you don't need your paycheck, you don't need your own employment benefits, and you want to go out on your own and do something or find another job with somebody or move out of state, 100%, yes, don't file an exemption. But that's not how it is. And I really think it's the opposite. It is, yes, vaccine mandates shouldn't be required, but if a private employer or a state can require whatever they want of you, that's part of being, especially a private employer, that's part of being employed. You are taking on their policies, but you do have First Amendment rights. And so I wouldn't agree with you on that necessarily. Okay. Something about nanotech fibers. I mean, I didn't open the link, but I'm guessing it is on the COVID swab tests. Are they real? I have no idea. Could they be real? Yes. It's part of why I don't take the swab. I don't want anything stuck in me that I don't know what's on it or what's in it. Our doctor moved out of state, and I just learned he cannot renew my new 7th graders exemption. So we need help ASAP. We're looking for a physician that can help us. There are no physicians in California that will write medical exemptions for 7th graders. Even if your doctor was still in state, they wouldn't have written one. I hate to be that blunt about it, but your options are to homeschool, independent study, move out of state, vaccinate. That's the options we have in California. Somebody asked about Vermont. Vermont's nice. New Hampshire's nice. It's cold there, but they're not too bad. Actually, Maine is not good. They don't have a they don't have a religious exemption anymore for K through 12. Can one request a religious exemption after getting some of the doses of the Pfizer or Moderna vaccine? It is hard. It's hard. If you have an epiphany and you talk to God in between, then maybe. Does anyone know the school code or law that exempts IEP students? It is in the Health and Safety Code, like 120372 maybe. But if you look up Health and Safety Code, California vaccination, it'll come up. Oh, okay. By discriminating, I'm saying that they require only non-vaccinated to test weekly, $100 PCR test, and yet they are not asking the vaccinated students to get tested weekly, even though there's now there's a child now that has COVID and she is vaccinated. I agree. And I think what you need to do is you need to rally other parents around that. The way to change school policies and school boards is by rallying as many people as possible. This is very sweet. Thank you. Says, you're an angel. Really don't know how else to describe you. We are so incredibly blessed to have your support and how you share knowledge with us. Thank you. You're so welcome. How do I respond to someone that disagrees what I think about medical freedom when they tell me that they had a parent die of COVID? So my biggest answer to this is you cannot expect them to, you need to plant seeds. You can't expect somebody to change their mind overnight. You need to plant seeds of things like corruption, censorship. If they had a parent die of COVID, they had a parent die of COVID. That is traumatic on them. But what, an example right now I would use is that the fact that the COVID transmission can be through vaccinated people. So it's, vaccination isn't the answer necessarily. I think it's hard, I really go with empathy over anything that makes people defensive. Some people you're never going to win over. To me, there's two ends of the spectrum, and the people that you're going to convince or are more likely to convince are the people in the middle. They're not the people on the extremes. Have you heard of any COVID containment camps for the unvaccinated? Do you know if this is a real thing? I have not. In my one direction on this side of the spectrum of what could happen. Could it happen? Yes. Is there a test for T cells or B cells that would show if one had COVID? If so, what's the lab who runs it? There is a T cell. There's one T cell test that I know of that has been emergency use authorized. I will say I thought I had COVID. I'm pretty sure I had COVID. And my T cells don't show up either. I think the key to me is our immune system is so incredibly complex. The other piece is that even if you have those antibodies, it doesn't matter if you have regular antibodies, they're not going to mean anything right now. It seems that the Delta variant started once people started getting vaccinated. Yes, and there's a lot of research on that, or not research, there's a lot of conjecture on that. Can an IEP be used for college students or just K through 12? So you can't get an IEP once you're over, if you're out of the K through 12 system, I don't believe. Do you know if Dr. Sutton has had her license revoked or is being disciplined? She has not yet. She's gone through the process. She is waiting for the medical board to make to rule on it. My guess, if I had to guess, is she will be disciplined in some way. Whether that's for vaccinations or not is a good question, but they will discipline her. They will put her on her probation. My guess is for 3 years, even if it's just for not having good enough medical records, writing good enough medical records, but they will make a point to discipline her so that all of her exemptions go away. Can I vote for you for governor? You can't. I'm afraid not. I would never, ever do it. No, no. And the reason why I wouldn't do it, I'll come back to that and explain that a little bit. The reason why I wouldn't do it is because it is too political. It's just a political place. And I'm just not political enough. I much prefer giving vaccine exemption workshops and finding loopholes and getting around the system and getting out of the system than being in the system. Okay. Who's making money off these vaccines if they're free? The government paid billions of dollars to the vaccine companies. They may be free to you, but they got their payment. Is there something a retired, not employed person should do? What about losing Medicare coverage? I don't think you'll lose Medicare coverage because that's a federal issue, and I don't think that would pass. There's really not anything you can do as a retired person other than try and educate other people. Get people to vote on yes on the recall. Oh, okay, I'll answer this one. I would like to donate for this. So great for your help, but would like to keep it untracked. How do I donate without being in the system? So you can, if you donate, we don't, unless it's a donation of over, I think it's $5,000 to our 501c3. So if you donate to a Voice for Choice Advocacy, which is our 501c4, it is not in this. I mean, it's on my computer, but it's not in any system otherwise. If you write a check, or you can send a money order. That's the money order is probably the easiest way to not be in the system, because you can write a money order for however much and just send it to us, and it doesn't have to have your name on it. But thank you for offering to donate. I will say, as I said, I don't make any money off any of this. I don't pay myself for this. I put thousands of dollars into a Voice for Choice Advocacy. If you make a donation to a Voice for Choice Advocacy, it goes to our interns. So we have 5 interns working for us. I really am looking for 2 more part-time employees. We have 1 part-time employee, actually 2 part-time employees, 5 interns, and they just take some of the load off my plate. And so if you donate, that's what the money is going for. We do pay them decently. Are vax people asymptomatic transmitters? Is that a test to confirm immunity if you've had a recent variant infection? So yes, vaccinated have been shown to be asymptomatic transmitters. You can get an antibody test for COVID. So there's a question about religious exemptions. They asked if I declined a vaccine, and I said yes, the flu vaccine. Does that hurt you? No, it doesn't hurt you. To me, you have to be truthful in your religious exemption. They're looking at the sincerity of your beliefs, not what your religious beliefs are. 2 questions. What do you mean by getting out of the system? Do you mean the medical system, the vaccine system, the COVID testing system? I mean every system. Honestly, I did a video. It's probably early this year. It's on our YouTube channel, which is a Voice for Choice, and it's something like working inside and outside of the sandbox, or being an activist inside or outside the sandbox, that kind of thing. And in the second half of that, I go through what it means getting out of the system. I mean, getting out of the food system. I mean, getting out of the medical system. I mean, getting out of the education system. I mean, getting out of the healthcare system. I mean, getting out of every system that is a regular system and run by the government or large corporations. Now, as I said at the beginning of this, you can't do that overnight. So work out what pieces of that can you take on? What can you do? It may be homeschooling your kids, or it may be planting a garden. It may be moving to a state that just allows you to be more free. It may be getting a job at a company that doesn't require the vaccine. It may be working for yourself. You're not going to be able to change and get out of the system overnight, but you need to have goals of what you want to work towards. What is your take on the notion that testing, regardless of swab, might involve getting personal information and biological material, DNA, for uses not known, potentially dangerous or mysterious? Do you feel testing has the potential to be dangerous in any way? Yes. So again, do I have any proof of this? Yes and no. So I should say there are some testing companies that you basically, when you're signing up for the testing, you have to basically sign your DNA away. They say they can use it for whatever you want. So I would definitely read the fine print on your lab and what they're going to do with your sample after they've run the test on it. There is a company that has basically been selling the DNA of Americans to China. Is there potential to use that for AI in the future, or for other, bioweapons in the future? Yes. Again, that's going down the worst possible road on these, what would normally be called conspiracy theories, but so many conspiracy theories have come true this year that they're no longer conspiracy theories. But so am I concerned about your DNA in this testing? I am. My recommendation is ask the lab what they do with it afterwards, and ask them if there's any way that you can get out of them using, that you can exempt yourself or your DNA being used in that way. Okay, I've heard the nasal swab has a carcinogen in it. One outspoken doctor said that the nasal test swab was the start of the vaccine. And I don't know why they have to shove this swab up near the brain. What's your opinion on the safety of the PCR nasal swab? So most of them no longer go up the brain. Those were the initial ones. They now are just in the sort of interior nasal cavity. But it's the reason why I would go with a saliva swab. Do I have any idea whether any of that's true, whether it's the start of the vaccine, whether it has a carcinogen on it? I don't, but could it? Yes, absolutely. Would you please address natural immunity? I'm not sure what you want me to address about natural immunity. Does it exist? Yes. Do I think there's long-term natural immunity? Yes, because I can guarantee you if a whole bunch of people who had COVID were getting COVID twice, we would hear about it on the news. So my guess is that natural immunity lasts for at least a year, because we haven't heard of people that had COVID in the height of COVID in 2020 that are getting COVID now. So do I think there is? I also think a lot of people who had COVID got the vaccine. So I think that's been conflated. That information has been conflated. Okay, the FDA section 564 prohibits consequences for refusing the EUA vaccine, that it's because it's not authorized and was not for the COVID vaccines. Is requiring testing a consequence? So the whole EUA thing and having to and not having consequences for refusing, no, they can still require you to test. The whole point of this is the EUA is going away next month. So any of these arguments that you may use today wouldn't work next month. And so, why spend your time on them? Find a loophole that works forever. My hospital did not allow a religious exemption for the flu shot at all. That goes against federal law. So you should contact me and I'll send them an email about it. They still don't. What is the chances of the religious exemption and medical exemption taken away for the COVID vaccine? If you're an employee, you cannot get them. They're part of the Civil Rights Act. And there's been so much case law on it that you can't, they won't be taken away. If they are, we're in a really, really, really bad place. We're in a much worse place than I ever thought we would be in the United States. My son's private school requires a mask inside. We're in Florida. I thought the mask was optional, and the Governor DeSantis says it's up to the parents to choose. Is this legal to mandate his mask at school? My daughter's private school doesn't require it. So the Florida laws I'm not familiar with. I read one school basically made the mask part of their school uniform, and that's the way they're getting around it. I think it's up to you to, either find a lawyer in California, in Florida, or go to DeSantis's. He's one of the schools, they were saying they were going to have a mask mandate, and he said he was going to pull their funding. Now this is a private school, so that doesn't really follow, but I would look at what other people are doing that are in the same situation and see where, are there lawyers, are there other advocates, are there other people in the school? What would happen if your son didn't wear a mask, one day, or if you've got 10 kids not to wear a mask? I wouldn't put your one kid in that position. But if you have, 20 parents that are willing to do it, and 20 kids that are, vocal enough about it and willing to do it, then, maybe that's the way to do it. I've been told you have to be fully vaccinated to do independent study. No, you don't. Independent study is exempt from the vaccination requirements that's in the law. Why are vaccinated not wanting to be around the unvaccinated? Aren't they supposed to be protected by the vaccine? Yes, it makes no sense at all. The fear factor in all of this is so high. I mean, it's why do the vaccinated wear masks? If they believe in the vaccine, they wouldn't wear a mask. Even if they believe that the vaccine just causes less serious injuries, they would not wear the mask, but they still wear the masks, especially here in California. Let's put it that way. Okay, so asking me if I can recommend a lawyer in San Francisco. Sure, I can recommend many lawyers, but unless I know what it's for, I can't recommend a lawyer. I will say in most cases when people ask me for lawyers, I will explain to you why you don't have a case. Lawyers and court cases are really expensive, especially if you're looking to take them up to the Supreme Court. You're not going to win any of this stuff in the lower court. So you're looking to take them to the California Supreme Court or the federal Supreme Court. And I will say you need to make sure that you're not setting bad precedents. So if you lose it, you're setting precedents for everyone. So, saying I want to have a lawsuit, if you're going for a lawsuit, you're probably talking a good $100,000, if not more. If you have $100,000, I can tell you 100 things that you should do with that $100,000 before going to court. And I look at it from that perspective. Where are you going to spend your time, money, and effort? Where do we find sequencing tests in California? Any known company? There are labs. Don't think there are any in California. There's one lab, the Milford lab. They don't have to be in California for you to get sequencing done. So you can send your tests. The one thing I don't know of is any sequencing labs that use saliva testing. Most of them use nasal swabs. I actually have one of our interns calling different sequencing labs to find out if they will take a saliva test. And if they won't take a saliva test, if you were to spit on a nasal swab or, an oral swab, if you were to spit on that, if that would be good enough. But I don't have the results of that yet. How to rally other parents from within my school. You need to find, you need to work out who the other people are. How do you work that out? Look at the kids who aren't wearing masks at the playground, those types of things. I mean, it's not easy. It's funny, my daughter does COVID testing, and only the unvaccinated are testing. And so, but they can go into the nurse's office and do it discreetly. But, whoever else is in the nurse's office that day is also unvaccinated. So will they take Social Security away if you're not vaxxed? Could they pass a bill that says that? Yep, they could. But yeah, I mean, could they? Yes, it has to be passed by the legislature, by the Congress and the Senate. So is it likely? No, it's not likely. But could they? Yes, they could. You have to have the plan B. Why, you don't want to be reliant on Social Security. Find your plan B, work out how you can make money, whether it's selling stuff on eBay or it's doing something, looking after kids or, something. But find something to do that makes you money, that you're not on Social Security and dependent on the government. Okay, do you know of a company corporation that has been sued for an employee catching COVID? No, you can't sue for that, especially in California. You can't sue if an employee catches COVID. The employment is exempt from that. They passed a law here in California during COVID. How difficult is it to get a medical exemption if you have some type of autoimmune disease? It's very hard, especially in California. The key there is if your doctor believes you shouldn't be vaccinated, then it's easy. But you have to have a doctor that believes that. Do you know how effective natural immunity is with the Delta variant? I'm not seeing people get COVID twice, so I'm going to say it's pretty good. Are you familiar? Do you believe it's COVID virus actually making people sick? Are you familiar with the germ theory versus terrain theory? Do you not believe 5G or other EMF toxins, fear, bad weather, bad water, etc., cause people to get sick? Do you not believe getting sick is simply a detoxification process in general? Please see the work of Thomas Cowan and Dr. Andrew Kaufman and many, many others. So I have watched all that. I've watched it. Do I believe in one or the other? No, I believe in both. I think I personally, do I believe there's a virus? I do believe there's a virus. Do I believe that if you are not healthy, you are more likely to get sick? Yes. Do I think if you have tons of 5G and EMFs around you, you're going to get sicker? Yes, because your immune system is being battered. Do I think if you have bad water? Yes. Do I think it's all of those things? Yes. Do I think there is a virus? I do think there is a virus. I don't completely believe in terrain theory. I think there is something in between. Now, could I be proven wrong? Yes. I don't think there's enough evidence either way. Are we on the cusp of possibly a new breakthrough? Yeah, possibly. I haven't been convinced that there aren't viruses. So, I look at something like measles, and if there is a child that has spots all over them and they breathe on another child, that child gets the measles. Do I think that is due to terrain theory and 5G, EMFs, toxins, beer, bad wet water? No, I think measles is a virus. So I do believe there is some evidence of germ theory. Could I be proven wrong? Yes, absolutely. I could be proven wrong. This is my perspective. Everyone has to do their own research. I would really say, don't go with any one thing. Make sure you read all of the research and come to your own conclusions. Like, there are so many people that have come to me and be like, oh my God, Dr. Cowan, terrain theory, that's the way forward. That's the way to go. And I'm like, okay, but how much research have you done on your own? Have you just listened to Dr. Cowan and Kaufman's, pieces? Have you just listened to that side of the story? If you just listen to that side of the story, yeah, that's what you're going to believe. But you need to listen to everything. It's like, I don't watch TV, but when I'm like in a hotel, I will sit there and I will watch CNN, I will watch Fox News, and I will watch every other news that there is, because I want to see what the story is that they're telling each person. Most people only watch one in the US. Most people only watch one news program. They watch CNN or they watch Fox News. I can guarantee you, if you watch either of them and solely watch either of them, you are going to have a completely different perspective on life from the other person. If I made you watch the other one, you would have that perspective. And so to me, on anything, you have to look at all sides of it, and you have to come to your own conclusion. If you look at all sides of it and you then say, you know what, I'm going to go with terrain theory, or I'm going to go with germ theory, great, go for it. But I sit somewhere in the middle, because I don't think either of them are wrong, but I don't think either of them are the only reason. My mother lives in a senior apartment building. Can they require her to get the vaccine because she lives with other seniors? So you need to look at her contract. Her contract will have said whether she is required or not. They may kick her out. I would try a medical or a religious exemption there. I think you could have success with that. It also depends on whether she owns the apartment. If she owns the apartment, no, they cannot. Do you see insurance companies refusing coverage simply because a family is unvaccinated? I don't. I think the religious and the medical exemptions come into that somewhere, but I don't. Could they force you to pay extra? Yes, there's a university that's charging $750 extra for every unvaccinated child on campus. Any early insight on the Lambda variant? Seems it will just be a variant after variant. From what I've read, variants decline in strain. Do you agree? Is there ever an end? What does it take? I don't think, I think we've got COVID. COVID is the flu. I think that's where we're at. There will be forever variants. They will be forever, boosters required. You'll get your annual COVID booster as you do your flu booster. Should religious exemptions be filed before the EUA is done? Doesn't matter. I looked up Stand Up California, but how do I find like-minded people in San Francisco, especially in our school? It's a private religious school in San Francisco. So I would recommend going to if there's a join a group or join a local group or something like that, go to the San Francisco one. I would ask people on there. In your school, as I said, you need to find the people. You need to be sleuthy to find the people. My daughter's school requires us to do the testing costing $100 per week. How can I find which parents are not vaccinating at our school? We may be the only ones because the school sent out that 97% of the student body is vaccinated. Well, I think then you've probably got, I don't know, yourself and maybe one other family. So if that's the case, then, you know, you're on your own kind of thing. Do not feel safe wearing a mask because I have a walker and I am at high risk of falling if I do not have peripheral vision. I also have other medical conditions that make wearing a mask unsafe for me. How can I avoid wearing a mask in a store? I couldn't get a medical note. I would try just walking into the store. If you're in California, actually in most places, if you just walk in without one and just say I have a medical condition, they usually since the vaccine mandate, I mean the mask mandates went away, I found that if you walk into a store, not many people say anything. Somebody said, I'm retired, but the LA Opera is willing to accept either a medical exemption. Who do I give my letter to since there is no employer? You give it to whoever's demanding the exemption. I'm an independent contractor. I work in an elementary school district, travel to 9 schools teaching choir. I have not been notified of a jab mandate for teachers. Do I have a strong position or not to get the jab because I'm technically not a district employee? I do plan to prepare a religious exemption. They want me to teach singing in a mosque outside 3 feet apart. Ridiculous. Well, I'm not going to address the teaching singing in a mosque. I completely agree, but if that's what they're requiring you to do, if you're a contractor, it's a hard one. It's basically up to your school to tell you whether yes or no that you fall under the mandate. Because the mandate right now for teachers is either vaccinate or test. Because you're not an employee, I'm not sure that they can require that. I think they could require it, but I don't know. I'd have to go back and read the mandate as to whether contractors, volunteers, etc. fall under that. Don't think they do, but I'm not sure. Are there any reputable articles done by doctors or scientists that are not discredited to prove employers on the efficacy of wearing masks? I'm a public school teacher. This whole research process during COVID, I mean, I think it was obvious before COVID, but the whole research process during COVID has been a mess. And anytime a study has come out on masks saying that they're not good, it's been taken down. So there aren't very many, let's put it that way. I thank you all. I know there were lots more questions, but hopefully I got to most of them and covered most pieces of it, or you could put together bits and pieces. But I thank you. I thank you for showing up. If you didn't ask the questions, I wouldn't have anything to say. I'm going to post the recording of this on our A Voice for Choice YouTube channel. I will send it out in an email. If you, for some reason, aren't getting emails, they very often, especially if you have Gmail or Yahoo, they go to spam initially. So you have to put them back in your regular folder. So thank you and have a good night. And I hope I answered some questions. Take care. Good night.